Your doctor might not mention this when writing you a prescription, but it turns out that what you use to wash down your pills could actually impact how well the pills work. 9 News medical expert Dr. Payal Kohli joins us this morning to explain. Good morning.
Good morning.
So does it matter what you take with your pills?
It absolutely matters.
Really?
Yes, and this is something we don't talk about often enough in the office, but essentially there was a study that looked at 22 different liquids, water, not just regular water, tap water, mineral water, filtered water, alkaline water, coffee, tea, juice, milk, and what you use, Corey, makes a huge difference. So what do you use to take your pills?
Well, typically water, but I had always been told that you can't drink it with coffee because coffee is a diuretic and it dilutes whatever you're taking. But is that true?
Well, so you shouldn't take your pills with coffee, but for a different reason. So it's not because it's a diuretic, but it's actually a little acidic. So it changes the environment and then the way that the pill breaks down.
Really?
Similarly, if you put something into alkaline water, which is the opposite of acid, it releases 90% of the substance prematurely, especially if it's one of those enteric-coated pills. If you drink it with juice, certain types of juices can change the absorption as well, especially grapefruit juice, which actually changes the metabolism of many different types of tablets. So we can't take it, for example, with atorvastatin or certain other heart failure type of medications because it changes the way the pill is broken down. The milk has calcium in it. Calcium can chelate or sort of coat over, those minerals can coat over some of the chemicals in the pill. So it's really, really important that you take it just with regular tap water or with filtered water.
So water's kind of the best. What if you don't wash it down with anything?
That's bad too.
Really?
Yes, really bad. Yeah, so you're sort of stuck between a rock and a hard place. And it depends on different pills, I should say. But for most pills, you need to have some amount of water to actually help the absorption of the pill and also to prevent it from getting stuck. So I've had a few patients who have what's called pill esophagitis, where the esophagus gets inflamed because this pill gets stuck, creates a chemical reaction in the esophagus. Not only is it extremely painful, you can feel it kind of in the middle of your chest, but it can cause damage to the esophagus. You need to make sure you have enough water to wash it down, and then there's enough contents in your stomach for the most part, for most pills, to actually break them down. Now there's certain pills, as you might know, the weight loss pills, as well as the thyroid medications, the stomach acid medications like omeprazole, pantoprazole, they have to have a completely empty stomach. So that you want to try to take with as little water as possible. So very complicated, but really it's very specific to every pill. So you need to know which pills you're taking with what types of liquids and how much of those liquids.
Does it matter the type of pill, like if it's like a capsule or whatever versus not?
It does matter. So tablets, capsules, gels, they all break down at different rates. And you know, some of them are sublingual. Those are nice because they go directly into the bloodstream. They don't really need to go into the stomach to break down. But we know that, for example, aspirin comes in what's called enteric coated, right? So if you take aspirin with alkaline water, it's not going to be timed release. It's not going to be gentle on your stomach. It'll actually break down the aspirin a lot faster and potentially cause damage to the lining of the stomach. So those enteric coated pills are the most important ones to make sure that you just take with regular water, you know, the tap water or the filtered water, not alkaline, nothing fancy, no smart waters with your electrolytes, none of that stuff. But some of the other pills as well, like I mentioned, the weight loss pills, as well as the thyroid pills, the stomach acid pills, they all need to be on an empty stomach. So you have to be careful with those too.
I feel like this is so good for people to know because I think a lot of people take pills in the morning. And they're taking with breakfast and they're usually drinking orange juice or coffee or tea.
Right, exactly right. And so I have really told my patients, you don't want to do any of that. In fact, you may even want to ask the doctor or the pharmacist. So I always tell my patients to talk to the pharmacist, their best resource, how much time you need to wait before or after eating to take the pills. Because people just think a pill is a pill and it works the same no matter what you do. But it's so sensitive to so many different factors that you want to be careful. In fact, even if you take a bunch of pills and start exercising right away, that can even change the way that some of those pills are absorbed.
Who's most affected by this?
So really, we worry most about older patients. We worry about patients who have problems with swallowing. We worry about patients like diabetic patients who have trouble with it's called gastroparesis, where the stomach contents don't empty normally. So the pills tend to sit in the stomach longer. And now in the weight loss era, all these patients on weight loss medicines, it changes the way the stomach empties. So it may automatically change the way that the pill is absorbed or where it's absorbed because the stomach's not emptying in a normal way. So So we really worry about all these patients, and I always tell my patients, don't crush, split, do any of those things to your tablet without talking to your doctor or pharmacist, because if you crush a pill, you could completely change the way that your body reacts to it.
Who knew? That is such great information, a lot to unpack there. But like you were saying, ask your doctor or the pharmacist the best way to take the pill.
Unfortunately, only about 9% of tablets come with instructions. So make sure you talk to those people. And then when in doubt, your best bets are tap water or filtered water.
Okay.
Okay?
Good to know.
All right.
Dr. Kohli, thank you so much. Katie?